Sign and symptoms in pleurisy. Pleurisy or pleuritis, that is inflammation of the pleura, the two layers, membranous layers which cover the either lungs in the human body. And it is a inflammation of these two layers. The symptoms produced by this pathology is the crucial stabbing and tearing pain in the affected person. There is fever with chills, nausea, vomiting, breathlessness, shortness of breath, tachycardia, dry cough. Sometimes it may be associated with hemoptysis. So these are the main complaints by the patients. And there is also anorexia, cachexia, and the weight loss when the pathology or treatment is prolonged one. For diagnosis, history of the patient is evident. On auscultation, there is pleural friction rub, clearly heard by the auscultation by the staff, by the healthcare providers. Next is the blood examination for pathogens. If it is infected one, that is viruses and the pathogen and fungus, the sample is sent to the laboratory, and also culture and sensitivity test is performed for the appropriate antibiotic selection. Then there is C-reactive protein test, which is elevated, that indicates inflammation of the pleura. X-ray chest simple, CT scan, MRI, and the ultrasonography of the chest. By the ultrasound study, we can get picture of the interior of the pleural space, air, pus, blood, and the fluid accumulated in the pleural cavity. That is, cavity means the space between the two visceral and the parietal pleura. So these can be easily visualized by the ultrasound scans. Now the most modern and the reliable test is fluoroscopy or the endoscope. That is, we have to see the interior of the pleural cavity by means of an electronic device or tool. It is called as endoscope or is termed as fluoroscope. So it is fitted with light and video camera. It is introduced by incision in the intercostal muscles into the pleural cavity. By this process, we can estimate the amount of quantity of the fluid accumulated in the pleural cavity, whether it is blood, whether it is pus, whether it is air, that can easily be visualized and examined by this direct approach of this endoscope tool. So these are the various processes which are employed for the investigation and diagnosis of the pleurisy in human being.